Hey Crystal, have you started the Physiology project yet?
No, I kind of procrastinated. Very last minute.
I totally am too, yeah.
It's terrible. Hey, you seem quiet. What's up?
Well, my sister just got diagnosed with schizophrenia today, and she's only 17 years old.
What is schizophrenia?
Schizophrenia is a severe brain disorder that is characterized by delusions, hallucinations, thought disorders, and inappropriate emotional responses and social behavior, resulting in psychosis.
Is all schizophrenia the same?
The classification of schizophrenia is based on two main types. People with type 1, or positive schizophrenia, which is a result of hyperdopamine activity that is caused by increased activity of dopamine 2 receptors in the brain. They also tend to suffer from more of the positive symptoms, such as delusions, hallucinations, and psychosis. People with type 2, or negative schizophrenia, which is a result of hypodopamine activity that is caused by decreased activity of the dopamine 1 receptors in the brain. They have more negative symptoms, such as withdrawing from others and a slowing of mental and physical reactions.
But do they know what causes it?
Well, the doctor told her it has something to do with like neurotransmitters or something. Researchers don't know for sure what causes schizophrenia, but studies have shown that there is a strong correlation between schizophrenia and neurotransmitters such as glutamate and dopamine. Neurotransmitters have many roles related to thought, speech, and memory. Glutamate has an important role in learning and the formation of memory. Dopamine is associated with feelings of pleasure and well-being. Receptors for these neurotransmitters are all proteins that are found on the cell membrane. These proteins are very important because they allow neurons to respond to the action potentials that are traveling along the axon. Some medications for schizophrenia act by blocking the protein receptors in order to prevent the reuptake of the excess neurotransmitters within the synapse. This maintains homeostasis within the brain. Other neurotransmitters that have been associated with schizophrenia are NMDA, serotonin, GABA, and norepinephrine.
Is it just the neurotransmitters that are affected?
No, there's actual structural deformities within the brain. The main structural deformities that are present in the brains of those who have schizophrenia are enlarged ventricles, specifically the lateral and third ventricles, smaller thalamus and temporal lobe, which regulates emotion and memory, dysfunction in the limbic and prefrontal regions of the brain, which results in agitation and reduction of blood flow and glucose metabolism, increased density of the dopamine 2 receptors in the basal ganglia, and excess glutamate activity causes hypermetabolism of the hippocampus, leading to atrophy.
Wait, is it contagious?
No, the doctor said that it's not contagious, but there are many possible causes of it. Schizophrenia has been linked to brain injuries, birth complications, genetics, and environmental factors. Schizophrenia is most prevalent between the ages of 17 to 25. Some researchers state that a deficiency in vitamin D while in utero may also contribute to the malformation of the brain, potentially resulting in schizophrenia of the unborn baby. The development of the brain is a crucial part of homeostasis. When the brain is developing, the neural connections must be properly arranged in order for correct communication to occur.
So what happens to your sister now?
Well, the doctor told her that with pharmacological therapy, it is very likely that she'll be able to live a normal and functional life.
Well, that's good to hear. At least you don't have to worry about it.
I know, what a relief.